Parents always have concerns for the health and well-being of their kids, and that has only been heightened, of course, during the pandemic. We are joined this evening by Dr. Jennifer DeLucia, a pediatrician with ProMedica and a partner with the V Project. We appreciate these interviews each and every Wednesday. Thank you so much for joining us, Doctor. What can parents do to ensure that their kids stay safe at school, and, especially when it does or does not require a mask?
Right. Well, there's several things, Jeff, that we need to do. The first thing is, of course, if they're ages 12 and above, we really need to get them vaccinated. That's becoming even more of a serious consideration, getting them vaccinated, as we get closer to flu season. And also now that classes are in session again and kids are passing diseases to each other all over the place. So if your school district doesn't require a mask, you can still mask. Now, granted, that's a hard sell with kids. It's a hard sell with my own 14-year-old. But the other things that you can do are, if the schools have good ventilation systems, that's really important. You can have the kids try to distance, at least leave 3 feet between themselves and other students. And then if the classes are able to be moved outside, that plays a huge role as well. So layering those protections will really help keep people safe.
Doctor, we did an interview last week with a psychologist talking about putting the onus on these kids to make the mask decision themselves. It's like another level of peer pressure. Talk about the steps that parents can take in the morning to try to ensure their child is well enough to go to school.
The symptoms of COVID-19 are similar to the symptoms of all the other coughs and colds that go around. So you see fever, sore throat, cough, runny nose, stuffy nose, sometimes sneezing, sometimes stomach aches and vomiting. If your child has any of those symptoms, at this point, unless it's really mild, they should probably stay home. If they have 2 to 3 of those symptoms, a lot of school districts are requiring that the kids be tested and have a negative PCR before they return to school.
What's the general consensus about flu shots this year?
Oh, yeah, Jeff, flu shots are more important than ever this year. We didn't see a lot of flu cases last year, in part because viruses are competitive and COVID-19 was outcompeting everything else. This year, there's going to be hopefully a little less of that because some of the population and some of the kids, including, are already vaccinated. So we may have a serious flu season. We don't know yet. But the best way to protect kids from getting both, and yes, they can get both. If your immune system is already down with COVID-19 and you get the flu on top of that, that's going to make for a really serious, probably course that requires hospitalization. So get your kids, if they're 12 and over, vaccinated for COVID right now, and then get the flu shot as soon as it becomes available.
All right, Doctor, as always, we appreciate the insight. Once again, Dr. Jennifer DeLucia with ProMedica and also a partner of the V Project joining us. Thank you so much. Good to see you.
Thanks, Jeff.